The purpose of both the electronic medical record and research in quality of care is to guide clinicians toward better practices. At the 8th Annual Chicago Supportive Oncology Conference, Dr. Susan Block and Dr. Sidney Dye discussed why measuring quality in palliative care is so important, and yet so difficult to do so.
I think the idea of using the EMR not just as a repository of information, but in a way as a tool for guiding clinicians towards best practices is really an important idea. And we've done a lot of work in our system on developing what we call an advanced care planning module for our electronic health record, which has all the kind of critical elements that are relevant to doing palliative care planning, end-of-life planning. And we've actually aligned it with work we're doing on a serious illness communication checklist to structure the kinds of conversations we think represent best practices for non-palliative care experts to be having with their patients around end-of-life planning.
So some of the key principles about measuring quality in general and measuring quality in palliative care is to really think about why you're measuring. And measurement is really difficult. It's really important, but it's really hard. And if you measure something badly and you get bad data, it can really go down the wrong path. Or if you're trying to measure something where you don't have the correct data. So that's another thing with EMR, with your information. For example, one thing we want to measure is that requires documentation of performance status. Well, in one of our EMRs, it's really hard to find. It's really important to think about it carefully. What's the purpose? Who is your audience? There's a lot of great quality measures out now that have been developed. What is the data that you have? So in administrative data, you may have an EMR, you may have unstructured medical records, you may need information from patients or providers. What kind of things do you have resources to do? And you really want to measure things that are important, that you can measure well, and ideally something that you can actually have an impact on.
I think the other question about measurement of quality goes back to this idea, are we measuring quality for research purposes, or are we measuring it for the purpose of quality improvement? And in our partners' health system, we now have created an end-of-life care dashboard that we're tracking across all of our hospitals, not just our palliative care programs, where we are measuring kind of key elements and reporting them that are that we think are good quality indicators for end-of-life care, including things like hospice utilization, presence of advanced care planning documentation in the medical record, hospital days, a whole bunch of different kind of parameters. One of the things that's been fascinating about that is how hard it is to get the data and to get comparable data and to really know what we have. And so we're now on version 2 of this quality dashboard, and we're still trying to kind of refine the measurement and making sure, well, what's the denominator is one of the big questions. Who should we be included in this palliative? It should be included in this, representation of quality in palliative care. So it's also spurred a lot of change in our system to have this dashboard. One of the things that rose to the forefront was the fact that we had no outcomes related to the patient's end-of-life experience, either from their perspective or the family's perspective. And so we're just completed a whole process of developing a family survey of their perceptions of quality that is now going to be integrated into the dashboard. But it's been, I think, a really useful tool, this dashboard, for trying to look at what we have and what we don't have and where we want to improve our